Thank you very much for the very nice introduction. We are celebrating a castle festivity in 3 weeks, and I will be dressed as a dragon. So after the two beautiful talks that you had on human milk oligosaccharides and the important role that they have, in the talk on microbes and the role of microbes in allergy, my task is to give you some new data on the role of human milk oligosaccharides in the management of allergy. So that's my conflict of interest. It's more than just ends. And this is the layout of the presentation. And of course, breastfeeding is the best way how to feed all infants, and every effort should be stimulated to breastfeed infants as much as possible, but not every infant can be breastfed. And we use cow's milk-based infant formula as a second choice infant feeding. But infants do get allergic to that infant formula based on intact cow's milk protein, and it's generally recognized that extensive hydrolysates are the first line recommended treatment for cow's milk protein allergy. And you heard in the first presentation the role of HMOs in mother's milk and their virtual absence in cow's milk. And so the topic of the presentation today is if adding human milk oligosaccharides to that extensive hydrolysate helps in the treatment of cow's milk protein allergy. So first, a few data that there are from the clinical situation on HMO and growth in healthy infants. And these are relatively old data, 2 years old, not so old, but on the growth of healthy infants supplemented with an infant formula with intact protein and 2 HMOs, 2FL and LNNT. And you see that for the growth of both boys and girls, that it is completely excellent, that there is no difference, so that the growth of those infants with intact protein formula is completely normal. A very recent study published earlier this year is on the growth of, again, healthy infants, but fed a partial whey hydrolysate as protein source, all supplemented with probiotics with Bifidobacterium lactis. And the only difference between both formulas is the presence of 2FL or no 2FL. And the result of that study is that the infants did grow very well, completely normal, no difference between both groups, and that the partially hydrolyzed infant formula with 2FL and B-lactis was very well tolerated, as confirmed by a validated multi-symptom index questionnaire. And then there is also this study from Spain, from this year also, which focuses on the growth and the feeding tolerance of infants consuming a formula then enriched with 2 HMOs. And the result of this study is that the age-appropriate growth is in line with the World Health Organization standards and previous studies shown in similar population, that the formula was well tolerated, as indicated again by the low gastrointestinal burden scores, and that the gastrointestinal tolerance was comparable with this formula to breastfed infants, as indicated by similar scores of the questionnaires. So there is quite some evidence from literature and new data that the addition of human milk oligosaccharides to infant formula in healthy infants results in a complete normal growth. New data are just being available since a couple of days, couple of weeks, where a controlled, double-blind, randomized, multicenter interventional clinical trial of 2 parallel formula-fed groups was set up to show non-inferiority in growth of infants taking test formula versus the control formula. And what it shows you is that the one side, the test formula, was Altera, but with a reduced protein content, with added human milk oligosaccharides, and the control formula is the classic extensive whey hydrolysates. And these are the inclusion and exclusion criteria for this study, and because of lack of time, I will not go into detail. But so inclusion was infants with physician-diagnosed cosmic protein allergy as per standard clinical practice, and with at least 2 symptoms. And for the diagnosis based on either a positive IgE blood test or skin prick test, patch test, or food challenge, only 1 symptom was needed to be included. And these are the growth data, both for the full analysis set and for the control group and for the group with the HMO. And you see that the growth of both groups is absolutely identical and completely normal, going from just below the 0 to just above the 0 line, because of course at diagnosis all of those children show some degree of malnutrition. So a normal evolution of the Z-scores for the weight for age Z-scores, as you can expect. And the non-inferiority margin was put at a difference of 3 grams per day. And you see here also that for both analyses, the full analysis or the per protocol analysis set, that there is p-value which is highly significant, showing non-inferiority between both groups, so resulting in a normal growth. So what are the clinical data that there are with this extensive whey hydrolysate with HMOs? What is the clinical efficacy? Well, for the non-supplemented extensive whey hydrolysate, there are several intervention trials which have been published in literature, 2008, 2013, 2015, which all show that this extensive hydrolysate is very effective in the management of cosmic protein allergy and fulfills the requirements to be considered as a hypoallergenic formula. Does the addition of HMO now help or not in the treatment of cosmic protein allergy? I come back to exclusively breastfed infants from secretor and non-secretor models, which shows you that an exclusively breastfed infant from a non-secretor model has a 3 times higher risk to develop atopic dermatitis than an exclusively breastfed infant from a secretor model. Again, showing you that the addition of HMO, or the availability of HMO and the influence, yes or no, on the microbiome will result in a decrease of atopic manifestations here in exclusively breastfed infants. And to show just a little bit other data on HMO and immunological effect that they have. So what this paper shows is that HMOs can bind to the cell surface receptors expressed on epithelial cells and cells of the immune system, and thus modulate neonatal immunity in the infant gut. Or because human milk has pre- and probiotic properties, the anti-allergy protection afforded by human milk may be due to its control on the developing gut microbiome. Or what this paper says is that HMO 6XL and 2FL modulate human epithelial cell responses related to the allergic disease. So there is certainly some evidence from literature that the addition of HMO is a logic step in the management of cosmic protein allergy. And this study shows you some clinical data on plasma inflammatory cytokines from breastfed infants, which are the light blue, and the heavy blue is with galacto-oligosaccharides, and the orange and green is with low levels and higher levels of 2FL. And you see that all those levels of inflammatory cytokines are with the human milk oligosaccharides much closer to that of the breastfed infant than with the galacto-oligosaccharides. So it's clear also that the immune effect of human milk oligosaccharides differs from the immune effect of non-human milk oligosaccharides. So data that were just presented a couple of days ago is a new clinical trial confirming the hypoallergenicity of the novel whey-based extensive hydrolyzed infant formula containing 2 human milk oligosaccharides. So it's a crossover study with 2 double-blind placebo-controlled food challenges. And what it shows you is that there was 1 allergic reaction to the test formula and 1 to the control formula. And the conclusion of this trial is that the whey-based extensive hydrolysate supplemented with 2-FL and LNNT meets the clinical hypoallergenicity criteria and is suitable for the management of cosmic protein allergy in infants and young children. And so these were just the results of the double-blind placebo-controlled food challenge. So the subject participated in a 1-week open challenge, and during that 1 week, there were no reactions that warranted early discontinuation of the open formula change, so there was no change of the outcome of the data after the double-blind placebo-controlled food challenge or the 1 week following up open challenge. There are still much more data to come which need to be analyzed on microbiome and infection rate in those children with cosmic protein allergy. This brings me to the conclusion and what to come. Well, regarding anthropometrics, I think it has been shown clearly that infants receiving test formula with HMO and reduced protein content achieved normal growth in line with the World Health Organization growth reference, both in the healthy and the cosmic protein allergic infant. And the weight gain of infants receiving test formula is non-inferior to the growth of control formula, and so growth is completely normal and healthy. Again, from an older study, the Puccio study from 2017, we know that the HMOs modify the microbiome of those healthy infants and bring the microbiome of the infants getting the test formula closer to the microbiome of the breastfed infants compared to the control formula. And that results in more bifidobacteria and less possible pathogenic bacteria. So it changes the microbiome in healthy infants, and we know from the secondary outcome from that study that is related to a decreased rate of infections and infestations of lower respiratory tract diseases, less use of antibiotics, less use of antipyretics. But so we need now, and there will be analyzed new data that are expected on those parameters on infants with cosmic protein allergy, HMO and the microbiome, and HMO and infectious symptoms, and that will be for next year. So, conclusion, breast is definitely best, no discussion about that. The addition of HMO to infant formula brings the second choice infant feeding 1 step closer to the golden standard. And the addition of HMO to extensive hydrolysate formula with decreased protein content confirms efficacy of the effect of the extensive hydrolysate in the management of cosmic protein allergy and results in normal growth. Thank you for your attention.
Thank you very much.